If I choose to just follow my acoustic neuroma with periodic MRI scans, what are the risks?
This is a very great question. I think creates a dilemma for a number of patients that are in the watch and wait mode. And I think the misconception that some patients have is by not choosing to treat your tumor and therefore following the acoustic neuroma on MRI scans, I'm not taking any of I'm not taking any risks. I'm not taking any of the treatment risks. The problem is that the patients that are in the watch and wait mode, there are still significant risks that they need to be aware of. So watching your tumor is not a zero risk strategy. Um, and there's a number of reasons for this. First of all, in the watch and wait mode, the tumor could grow in size and cause symptoms. So now you went from having a small tumor with no symptoms to a larger tumor with symptoms. So you're in the situation where you have a larger tumor with symptoms, treatment now becomes more challenging. We know that smaller acoustic neuromas are easier to treat with both surgery and radiation. So small is easy. Minimal symptoms makes it easy to treat. As tumors get larger and as you develop more symptoms, both surgery and radiation get more difficult, meaning the risks of those treatments increase. So waiting and watching the tumor with MRI scans runs the risk that future treatment when you need it now is going to be more difficult in the sense that it's associated with increasing risk factors to the treatment. Additionally, if an acoustic neuroma grows too large, then the non-invasive option like cyberknife radiosurgery may no longer be an option. So you may lose potential treatment options. And this can be frustrating for the patient because when their tumor was first diagnosed, they were a candidate for radiosurgery. They watch the tumor now because of size and symptoms. Now the radiation option is no longer an option and surgery is the only remaining option. And some of these patients get frustrated because they feel like they lost a window of opportunity. Another factor to consider is that even if the tumor doesn't increase in size on subsequent MRI scans, a patient's symptoms could still worsen. So a scenario would be you're following a patient for 5 years with MRI scans, and over those 5 years, there's been no change in the patient's acoustic neuroma, which sounds good, but potentially over those 5 years, there could be, further reduction in hearing, additional balance disorders, increased tinnitus. So symptoms can worsen even in absent growth. So just because your tumor grew doesn't mean you're stable. You could be worse off. And then finally, there are some newer studies that show, particularly for radiosurgery, there is a benefit of treating early, meaning that you're potentially more likely to preserve your hearing if you treat with radiation early than you do if you were to watch the tumor and treat with radiation 5 years down the line. So these are just some of the factors that you need to keep in mind when determining whether to just observe your tumor with periodic MRI scans. I think the key point here is that observation is not a zero risk situation for the patient.